So hi guys, good afternoon to everyone. I just want to talk about something, guys. So I just want to introduce myself to every one of you who's watching my video now, all over the world. So my name is Joyce or Aisha, my Muslim name. But soon I will be converted again to Catholic, guys. So my name is Joyce. You can call me Joyce. So my page for TikTok is joy_charm28. And first of all, I am working in the autism center. It's one of the biggest rehabilitation in Saudi Arabia, and I offer ABA program, and also I am behavioral therapist, guys. And if you have children with has disability like with ADHD, or there is a diagnosis for severe or mild autism, any kind of children with this kind of disabilities or Down syndrome, guys. So because Down syndrome clients, like for example a person, they are very intelligent, and they can cope up with everything, and they will understand a lot of things, but they're very fast to learn a lot of things, the Down syndrome, guys. To compare with children with autism, there are some severe autism children. They are the one who's like with more behaviors like hitting, screaming, and laying on the ground or on the floor, and biting, and most of the time they're destroying and throwing things, guys. Those are the severe ones, and hurting people. So we have a different kinds of techniques for ABA program. And also I know I can have if I went home, I will just do some training with my autistic son, because I am a mom of an autistic son. He's already 28 years old, guys. So during his manifestations, during his young age, he was diagnosed with autism, like mild autism, guys. But before, he is really severe, guys. And 10 years, he never go out inside the house. He just stay at home. He don't want to see any people. And if you touch his things, and if you don't know how to handle this kind of things before, I really suffer a lot, guys. I suffered a lot more with my son, and he destroyed the television, and he was like barking like a dog outside the garage, and some people is like, and the neighbors are trying to complain about him. But they need to understand, guys, this one is not a normal person. This one has a disability. So for people, or for children, or any kind of person who has this kind of disability, you have to understand, and you don't have the right to hit them or something like this, because they will hit you back. And also, you need to understand what is the right thing that you need to teach them. Since that other people doesn't even know how to handle this kind of like person who has this kind of disability. And it's really hard if you have severe, and the mild, or like moderate, or like something like this, that they can cope up with everything, they can be corrected. But we cannot correct the behavior right away, okay? It will take time, and there's a lot of trainings that you need to do. And there are also people who has problem with the verbal. There are also non-verbal children, or clients that I have, because in the school I have 4 clients, and they are like 20, 23, 18 years old, 15 years old, and one is 21 years old. So they are already like grown-ups. Before, when I was working in the center, I handled small children, like school age. So I am very particular on how to handle this kind of children. So I have the capacity that we cannot guarantee 100% that the behavior will not come back. And since that they are autism with this kind of disability with autism, so what you will do with them is you need to correct the behavior, but we can decrease. And for example, if the behavior of this child is like hitting too much, and then within one day he's hitting you maybe 50 times in one day, but we can do something to change his behavior, like to divert everything. I am also a psychologist, and I have a lot of things that I can handle, a lot of things, even though in the school I can teach behavior with behaviors and also with the speech, because this is not my specialization, but I was trained and I was trying to observe all the people working in the speech therapy, and I learned a lot of things how I can teach them. But there is something that cases like my client, he has echolalia. So most of the time, whenever you say something, he will repeat after you more, and he cannot stop saying a lot of things. Within the end of the day, he was trying to. He don't even want to keep quiet. And there are also nonverbal, guys. The nonverbal is like we can have PECs. PECs, if you search this one, P, capital E, capital C, and capital S. So PECs is the new method that we can use. And for those people who cannot afford, like for example, it's not like necessary that you need to buy something, but iPad or phone that you can download the PECs is very important for nonverbal, because this is how they can express the needs that they want to. For example, if they need something, they will just type in the PECs like I want, like with a sound. So this is how they can express what they need. And also we can do manual PECs. We can laminate papers, all the things that they want. You need to put everything there. So I really have to explain for you furthermore once that I have another video, guys. So for the meantime, I am a behavioral therapist, and my name is Joyce, and I have capacity to teach speech, OT for sensory. I have only a small idea about OT, and then my specialization, guys, is more on behaviors. So check with me again, guys, and hope you have a wonderful day.